In the construction industry for quite a long time there's been a focus on health and safety, but we have seen such a significant increase both in the reporting of mental health issues, suicides, construction workers 6 times more likely to have mental health illness. It really is something that we can't say no to as an industry, and working together is the way forward.
We work long hours. We work in environments that cover some risky trade work. That brings with it stresses and strains. And as a result, you can see that over time, people slowly get worn down. The challenges unique to construction mean that we have to put special effort into getting people to talk, getting people to understand where the challenges are and what they can actively do to make the situation better.
So my story goes 3 years ago to the start of 2018. We had probably what you call a bit of an ongoing family crisis at home with someone in our family who wasn't well with mental illness. You turn up to work and you give all your efforts to that, then you go home and try and manage a crisis or a situation at home. Often it means you don't sleep. And ultimately for me, it just ended up in utter exhaustion and point of collapse. And so at that point when you collapse and you're in hospital, you think, well, this is a bit of a wake-up call that I needed, and now that I've had that I can refocus on things. So I think my story has been trying to say to people, don't do what I did and try and quietly deal with it and say to everybody, I'm okay, while you exhaust yourself trying to deal with a personal or a family issue, but actually use the connections that are available. So whether it's mental health first aiders in the workplace, whether it's mates in construction, whether it's Beyond Blue, people on the site can help connect you with the right people so you're not alone.
We run a number of programs at Lendlease for our people and to support their mental health. We have mental health first aid training and we have a number of elements to that. We obviously have our EAP programs. We have Sleep Fit because we understand that sleep is the first thing to go when your mental health is struggling. We have Mates in Construction on our sites, so that covers our entire site, so our subcontractor workforce as well. People tell us that that's been really beneficial for them.
I think from a cost perspective, there's 2 ways you can look at it. It's either an investment in your future, or it's a short-term cost that maybe you could look at saying, could we do without this? With mental health, not only is there this moral obligation which is immediate, I think there's also a smart business initiative which is longer term, and those who see it and grab it will become employers of choice, retain their people, and there's an upside to the bottom line, there's an upside to culture when you're able to retain your employees. For small businesses in our sector, there's a lot of labour hire and smaller subcontractors who are providing services in the industry. And so an opportunity for them is to actually be aware of the whole range of programs that the New South Wales Government has put out around mentally healthy workplaces and safe workplaces. For me, a mentally healthy workplace has a number of factors. It's the way that we communicate to people so they don't feel alone in the workplace. It's the support networks and places to go that are readily available. It's an elimination of bullying and harassment in the workplace, and that we have an inclusive culture. And so ultimately we can transition to workplaces where people come in the gate and feel supported, and we will create workplaces where we provide opportunities for people to be at their best.